Pressure among teenagers is intense for ordinary kids. So imagine what it's like when your body weight is twice what it should be. For overweight teens, high school can be a living hell. But tonight, you'll meet a local man who channeled the torment and turned it into something very special. Nestled among the rolling hills of Greene County, Virginia, there's a wonderful school that's so idyllic it seems straight out of a Norman Rockwell painting. Over the years, thousands of teens have passed through the doors of William Monroe High and left with memories to cherish for a lifetime. Sadly, though, Austin Shiflett is not one of them. When you're twice the size that you should be, you walk down the hallway with your head down, and any type of athletic endeavor is an agonizing torment. For Austin, high school was a mean place.
I had the nickname Fat Boy in gym class, which, it started off as like a nickname, and then everyone started calling me it. It was just kind of like my name at that point. Other people take it like an insult, but to a lot of people, it was just like that was my name to them. That's what they knew me as, which kind of sucked.
Upon graduation, Austin started going to an all-night gym in Rockersville, where he would work out at 1, sometimes 2 in the morning, away from judgmental eyes. A high-protein, low-carb diet, along with hours on a treadmill and an elliptical bike, and the pounds started to melt away. At his all-time heaviest, Austin tipped the scales at 324 pounds. He lost 166 pounds and now weighs 159. But that monumental weight loss left mounds of disfiguring skin on his newly slight frame. Austin did not like what he saw in the mirror, and since cosmetic surgery is not covered by health insurance, it was out of the question.
I spent years looking up prices online for surgeries, and it was so expensive.
Enter local plastic surgeons Dr. Neil Zemmel and his partner, Dr. Stephen Montante. They were contacted by the producers for the TV show The Doctors, who were hoping they'd help Austin out and perform the needed work pro bono. There was so much excess skin, one procedure would not be enough. It would take 2.
Even though he's young, skin has its limits in terms of its ability to snap back. So he had a tremendous amount of loose extra skin after he lost the weight and his weight stabilized.
One procedure focused on his upper body, the chest. The more difficult procedure, his midsection. This was far more invasive than a regular tummy tuck because about 7 pounds of loose skin had to be removed from the circumference of his body.
He stretched out circumferentially all the way around. So not only did we take tissue from his abdomen, but we went all the way around his hips and even across the lower back and the buttocks and basically pulled everything up.
A kind of a bulge of skin here. So
as you can see, Austin has healed nicely. He's happy with his new look, which is actually providing him with income. Austin is now modeling and has several national TV commercials in the works. The cost of these surgeries would have been in the neighborhood of $45,000, an unattainable amount of money for Austin at his age. But Dr. Zemmel says he was glad to do it.
From a personal standpoint, this was extremely gratifying for myself, Megan, our PA, and my partner, Dr. Montante. We were able to really change his life. And we feel pretty good about it.
I'd always told myself I would get it, but realistically, probably never would have gotten it. I could never repay them or thank them enough for what they did.
Austin is quickly becoming a spokesperson for the Atkins diet and will be appearing in some of their TV and print ads very soon.